Hi, and welcome to our comprehensive guide on the lambing process. I'm Janine, and after many years of shepherding experience, I've learned that few farming experiences are as rewarding or as challenging as bringing new lambs into the world. Lambing is a culmination of a year's work for any shepherd. The decisions we make throughout the breeding season, pregnancy, and birth all contribute to the success of our flocks and the health of our lambs. In this video, we'll walk through the entire lambing journey, from preparation weeks before birth through labor and delivery. Whether you're an experienced shepherd or new to raising sheep, understanding this process is essential for the welfare of your animals and the success of your operation. While lambing is a natural process that sheep have managed for thousands of years, modern breeding practices and our responsibility as shepherds mean we need to be prepared to assist when necessary. You'll see real examples of normal births, but also learn when and how to recognize problems that require intervention. By the end of this video, you'll have a comprehensive understanding of what to expect during lambing season and the confidence to handle whatever challenges may arise. So let's begin with preparation, the foundation of a successful lambing season. Successful lambing begins long before the first contractions. Ideally, preparation starts 4 to 6 weeks before your expected lambing date. This timeline allows you to methodically address nutrition, health, and facility needs without the pressure of imminent births. Alright, let's start with nutrition. During mid-pregnancy, ewes require about 2 to 2.5% of their body weight in good quality feed daily. For a 150-pound ewe, that's roughly 3 to 4 pounds of feed. As we approach lambing, gradually increase energy density by introducing concentrates or higher quality hay. This fleshing helps ensure proper lamb development and prepares the ewe's body for the demands of lactation. Important not to overlook mineral supplementation. Calcium, selenium, and vitamin E are particularly important pre-lambing. Now let's talk vaccines. Vaccination timing is critical. The CDT vaccine, which protects against clostridial diseases like tetanus and enterotoxemia, should be administered 2 to 4 weeks before lambing. This timing allows antibodies to pass through colostrum to the newborn lambs. For ewes that haven't been vaccinated previously, a 2-shot series may be necessary, but consult with your veterinarian for that. This is also a time to address hoof trimming and shearing. These are things that you want to make sure you get done before the lambing season begins. That way you can relax knowing that the sheep has been vaccinated, has nice trimmed hooves, and the wool is off so that the lambs can find the teats easily. Now let's focus on lambing facilities. Start by thoroughly cleaning your lambing area. Remove all old bedding and disinfect the space if possible. Check for any hazards like protruding nails, loose boards, or gaps that could trap lambs. A clean slate reduces disease pressure and gives you the opportunity to properly configure your space. Bedding quality is non-negotiable. Clean, dry straw is ideal. It provides insulation, absorption, and a comfortable surface for both ewes and lambs. Deep bedding of 6 to 8 inches helps prevent hypothermia in newborn lambs, especially during cold weather lambing. Have extra bedding stored and nearby for quick replenishment. Now let's assemble our lambing kit. Essential items include, but are not limited to, obstetrical, lubricant, and disposable gloves for assisting difficult births, strong iodine solution, at least 7% for navel dipping, clean towels for drying lambs, feeding tubes and syringes for emergency feeding, colostrum replacer or frozen colostrum, a digital thermometer, heat lamp or warming box for chilled lambs, record-keeping materials, and your veterinarian's contact information. Now let's prepare your record-keeping system. Whether digital or paper-based, have a system ready to track breeding dates, lambing dates, birth weights, assistance required, and lamb identification. Good records are invaluable for future breeding decisions and flock management. As lambing approaches, learn to recognize the signs. Watch for udder development, loosening of the tail ligaments, and behavioral changes. These indicators, along with your breeding records, will help you anticipate when lambing will begin. As we enter the final 4 weeks before lambing, you'll notice significant changes in your ewes. Their abdomens are visibly distended, and they'll begin moving more deliberately as they carry the increasing weight of their developing lambs. Now let's talk about late pregnancy, which is the final 4 weeks. Nutrition during late pregnancy is critical. At this stage, 70% of fetal growth occurs, placing enormous demands on the ewe's body. Increase energy density in the diet by adding quality concentrates while maintaining adequate forage. As lambs grow in utero, there's less space for forage, making concentrated feed such as grains critical to ward off pregnancy toxemia. A properly fed ewe should receive approximately 15 to 20% more energy than during early pregnancy. On our farm, we also like to utilize protein tubs. They're a great way to bridge the gap in their nutrition. Now is the time to ensure adequate calcium and magnesium to prevent metabolic issues. Many shepherds add a mineral supplement specifically formulated for late pregnancy. Remember, ewes carrying twins or triplets need up to 30% more nutrition than those carrying singles. Adding high-quality alfalfa or legumes can help keep hypocalcemia at bay. Body condition scoring becomes essential during this period. Run your hand over the ewe's spine and ribs. You should aim for a score of 3 to 3.5 on a 5-point scale. This means you can feel the bones with slight pressure, but they're covered with moderate fat. Too thin and the ewe may not have enough reserves for lactation. Too fat and she risks difficult birth and pregnancy toxemia. Speaking of pregnancy toxemia, or ketosis, this metabolic disorder typically appears in the final 2 weeks before lambing. Watch for ewes that separate from the flock, appear lethargic, or stop eating. Early signs include grinding teeth, weakness, and an unsteady gait. If you suspect toxemia, immediate veterinary attention is crucial. Prevention through proper nutrition is always preferable to treatment. Now's the time to prepare your lambing jugs or individual pens. Each pen should measure at least 5 feet by 5 feet, providing adequate space for the ewe and her lambs while keeping them close enough to bond. Ensure the pens have fresh, deep bedding, preferably straw, and are draft-free while still having adequate ventilation. Oh my gosh, you guys, you gotta check out this sheep. I've been waiting for the sheep to lamb, I'm not kidding you, 2 weeks now. You gotta check out these udders, my gosh. In these final weeks, monitor udder development closely. The udder will begin to fill and enlarge, a process called bagging up. Initially, it may appear small and tight, but as lambing approaches, it becomes increasingly distended. When lambing is imminent, the teats will appear full and point slightly outward rather than downward. Watch for behavioral changes that signal approaching labor. Ewes may become restless, frequently getting up and lying down. They often separate from the flock, seeking isolation. You might notice them pawing at the ground, a nesting behavior, or looking back at their flanks as early contractions begin. During this critical period, increase your observation frequency. Many shepherds check their flocks every 4 to 6 hours, with more frequent checks as lambing approaches. Remember, preparation and vigilance during these final weeks will pay dividends in healthy ewes and thriving lambs. Recognizing the signs of imminent labor is essential for timely intervention when needed. Most ewes will lamb without assistance, but identifying these signs allows you to monitor more closely and be ready when help is required. The first signs often appear 12 to 24 hours before active labor begins. You'll notice behavioral changes as the ewe prepares for birth. One of the most reliable indicators is a ewe's desire for isolation. Maternal instinct drives her to seek a quiet, protected area away from the flock. This natural behavior helps protect the vulnerable newborn from predators and allows uninterrupted bonding. In a barn setting, you'll often see ewes gravitating towards corners or quiet areas. Watch for nesting behaviors. The ewe may paw at the ground or bedding, creating a shallow depression. She might circle repeatedly in one spot, lie down, get up again, and repeat this process. This restlessness intensifies as contractions begin. The vulva will appear swollen and loose, often with a noticeable reddening. You may observe a clear or amber-colored mucus discharge. This is the cervical plug releasing as the cervix begins to dilate. This discharge might appear as strings or globs on the ewe's tail or rear legs. If you see this, lambing is imminent. Look for dropping or hollowing around the tail head and pins or hip bones. The ligaments around the tail head soften and relax, making the tail appear more elevated and the area around it sunken. When these ligaments are fully relaxed, you can easily wiggle the tail from side to side, a reliable indicator that lambing is imminent, usually within around 12 hours. As early contractions begin, the ewe may display increasing discomfort. She might look back at her flank, arch her back, or grind her teeth. These are responses to the initial contractions that are positioning the lamb for delivery but aren't yet strong enough for active labor. The frequency of position changes will increase as labor approaches. The ewe becomes increasingly uncomfortable, unable to settle in one position for long. She may stretch as if urinating but produce no urine. This is often a response to contractions. Once you observe these signs, increase your monitoring frequency. Check the ewe every 1 to 2 hours if possible. Note the time when you first observe these indicators. This information becomes valuable if labor doesn't progress normally and veterinary assistance is needed. Also, remember that approximately 70% of ewes will lamb in the evening or overnight hours. Many shepherds use the night check rule of thirds. Check at 10, 2 a.m. and 6 a.m. during lambing season to catch most births or problems requiring assistance. Feeding late in the evening can help since sheep don't like to lamb when they're ruminating.
All right, well, I was up all night. I had a sheep that was in somewhat early labor, and today she's going for it. Look at me, I'm so tired. I'm like a little delusional, to be honest, but we're gonna have babies today. Yay!
Stage 1 of labor marks the beginning of the birthing process. This critical phase involves the cervical dilation and the positioning of the lamb for delivery. It can last anywhere from 2 to 6 hours in mature ewes and sometimes longer in first-time mothers or yearlings. During this stage, the ewe experiences mild to moderate contractions that are not yet visible externally. These contractions are working to move the lamb into the birth canal and dilate the cervix. You'll notice the ewe appears increasingly uncomfortable. She may pant slightly, grind her teeth, or have a distant inward-focused expression. Position changes become more frequent as the ewe tries to find comfort. She'll likely lie down, then stand again within minutes, repeating this pattern as contractions intensify. Some ewes circle continuously or press their head against a wall or corner during contractions. This is normal behavior. When you observe stronger, more rhythmic contractions, the ewe entering a trance-like state, or see the water bag emerging, you're moving from imminent labor to active labor. Stage 1 has begun. At this point, continue observation while preparing for delivery. Nesting behavior often intensifies during stage 1. The ewe may paw aggressively at bedding, sometimes appearing almost frantic in her preparation. This instinctive behavior helps create a clean, comfortable space for the imminent birth. As stage 1 progresses, you may notice increased vaginal discharge. This initially appears as clear or amber-colored mucus, but may become tinged with blood. This bloody show is normal and indicates the cervix is dilating properly. Don't confuse this with frank bleeding, which would be cause for concern. Timing is important during stage 1. Make note of when you first observe clear labor signs. For mature ewes, stage 1 typically resolves within 2 to 4 hours. First-time mothers may take 4 to 6 hours or occasionally longer. If a ewe has been in stage 1 labor for more than 6 hours without progressing to stage 2, closer monitoring is warranted. As stage 1 transitions to stage 2, contractions become stronger and more visible. You'll begin to see abdominal contractions where the ewe's sides visibly tighten. Her breathing pattern will change, becoming more rapid and shallow during contractions and returning to normal between them. Watch for the transition to active pushing. The ewe will usually lie down on her side or maintain a hunched seated position. She'll begin actively straining, often with her head extended forward and slightly up during contractions. This signals that stage 2 is beginning. The appearance of the amniotic sac or bubble at the vulva is a definitive sign that stage 1 has ended and stage 2 has begun. This translucent, fluid-filled membrane may appear as a bluish-gray bulge. Once visible, delivery of the lambs typically follows within 30 to 60 minutes. So when should you intervene during stage 1? Generally, intervention isn't needed unless the ewe appears in extreme distress beyond normal labor, you observe frank, bright red bleeding, the ewe has been in stage 1 for over 6 hours with no progression, the ewe stops showing labor signs and appears to give up, or the water bag appears but no lamb parts are visible within 30 minutes. If you need to examine a ewe during stage 1, remember to move slowly and speak softly. Use minimal restraint, often having an assistant gently hold the ewe's head while you examine her hindquarters is sufficient. Remember, stress can slow or stop labor progression. As we transition to stage 2, you'll see more active, purposeful straining from the ewe, and the water bag will become clearly visible at the vulva. This is when delivery begins in earnest and when you should be fully prepared to assist if necessary. Stage 2 of labor begins with the appearance of the water bag and ends with the delivery of the lamb. This is the active pushing phase where your careful observation is most critical. For experienced ewes, this stage typically lasts 30 minutes to an hour. First-time mothers may take longer. During stage 2, contractions become intense and purposeful. The ewe will usually lie on her side, though some prefer to remain standing until delivery is imminent. You'll observe visible straining. Her entire abdomen will contract as she pushes. Between contractions, she'll rest briefly before the next wave begins. The amniotic sac or water bag may break naturally, releasing clear fluid. Don't be alarmed by this, it's a normal part of the process. Sometimes the bag remains intact until the lamb's nose and feet appear. Either scenario is normal, though excessive fluid or discolored fluid may indicate problems. Once the head is out, I like to see the bag break, but if it doesn't, I'll sometimes break it quickly. In a normal presentation, you'll first see the amniotic sac followed by 2 front feet with the head resting on top of them, resembling a diver's position. The front feet typically appear with soles down, and you should see both feet emerging simultaneously or nearly so. The lamb's nose should follow closely behind the feet. This normal presentation, front feet first with nose following, occurs in approximately 95% of births, but recognizing abnormal presentations is crucial. If you see a single foot, feet with soles up indicating a backward presentation, head without feet, feet without a head following, or any part other than the feet or the head, these signal a malpresentation that may require intervention. In normal delivery, you'll see steady progress with each contraction. The feet will emerge further, followed by the nose, head, shoulders, and finally the body. The widest part of the delivery is the shoulders. Once they pass, the rest of the body usually follows quickly. Timing is critical during stage 2. Once the water bag appears, you should see progress with each contraction. If the ewe has been actively pushing for 30 minutes with no visible lamb parts, or if lamb parts are visible but haven't progressed for 15 to 20 minutes despite strong contractions, intervention may be necessary. If assistance is required, apply gentle traction only during contractions, pulling downward towards the ewe's hocks in a smooth arc. Pull one leg slightly ahead of the other to reduce shoulder width. Never pull both legs with equal force straight outward. This increases the diameter of the lamb's shoulders. The ewe will typically begin licking her lamb immediately after birth. This stimulates circulation and breathing while initiating the crucial bonding process. Allow this natural behavior whenever possible. It serves multiple physiological and psychological purposes for both you and lamb. If the lamb doesn't start breathing promptly, clear its airways by wiping mucus from the nose and mouth. You can stimulate breathing by rubbing the lamb vigorously with a towel or tickling its nostril with a piece of straw. For difficult cases, supporting the lamb with its head lower than its body helps drain fluid from the lungs. With multiple births, the second lamb typically follows within 30 to 45 minutes. If the ewe returns to active labor but shows no progress within 30 minutes, a manual examination may be necessary. Stage 3 of labor is the afterbirth. Stage 3 of labor begins after the lamb is delivered and concludes with the expulsion of the placenta or afterbirth. This final stage is critical but often overlooked by new shepherds who may be focused on the newborn lamb. After delivering the lambs, the ewes will continue to experience mild contractions as her uterus begins to expel the placenta. These contractions are less intense than during delivery but are essential for proper placental expulsion and help the uterus return to its normal size, a process called involution. You'll often see the placenta hanging from the ewe for some time before it completely detaches. Never pull on the placenta to speed its removal. This can cause uterine prolapse or leave portions retained inside the uterus. Allow it to separate naturally through the ewe's contractions. After passing the placenta, a ewe will have a normal discharge called lochia for 10 to 14 days. This discharge should be dark red to brownish in color with no strong odor. If you notice a foul smell, chunky or pus-like discharge, or if the ewe appears feverish or stops eating, contact your vet immediately as these are signs of uterine infection. Once the placenta has passed and you've confirmed it's complete, stage 3 is finished. The ewe has completed the birthing process and enters the postpartum period focused on nursing and caring for her lamb. Your attention now shifts to ensuring proper bonding and monitoring both you and lamb for any signs of complications. As we close, remember that each lambing season builds your experience and refines your judgment. What seems overwhelming to beginners becomes routine with time. Trust the process, learn from each challenge, and take pride in the ancient and honorable tradition of shepherding new life into the world. Thank you for joining us on this journey through the lambing process. We hope this guide serves you well in your shepherding endeavors. Best wishes for a successful lambing season.